11 counties, Polk, Pasco, Pinellas, Hillsborough, we asked them all for their data on EMS shortages. And emergency worker numbers are down right now and people are struggling. They get a call when things are at their worst. But can we do something to help them? 10 Tampa Bay's Miranda Parnell takes us on the road with EMS from the Bay Area to find out why our lifesavers need a lifeline.
What happens when the minutes, when the seconds that decide between a funeral and recovery are put at risk because our emergency responders are being stretched too thin? Staffing has been tough for years, but with the added stress of the pandemic, there are now hundreds of EMS vacancies in counties all around the Bay Area. And this is one worker shortage impacting the entire country that's a matter of life and death.
EMS is a calling. You genuinely want to do this, but the burnout is there.
Day after day,
they're getting two sepsis alerts at the same time.
Call after call. Our emergency medical teams step up to save lives. But an industry-wide worker shortage is wearing down crews across the country, and now they need help.
The workforce is tired. They're working overtime to cover those slots that can't be filled. So we're seeing this exhaustion, we're seeing this fatigue in the workforce.
Terrence Ramitar is the president of the Florida Ambulance Association, and he's been in the industry for almost 25 years. He says the shortage of EMTs and paramedics is worse now than it has ever been in his career.
Not many people walk around the day planning that they're going to have an emergency that day, but when it is, their expectation is that someone's there to help. And so not always during these times and not everywhere in the state of Florida are we going to be ready to have an ambulance around the corner waiting for your emergency.
Operations Supervisor with American Medical Response Valentin DeLorbe has been in the industry for more than 20 years. He says while emergency crews across the country are dealing with shortages, their jobs are also impacted by worker shortages at the hospitals.
So that domino effect from the nursing shortages, from the staffing shortages in the hospital, to us having staffing shortages, it just continues to trickle on and trickle on and trickle on.
Depending on your issue, if you call for an ambulance but there are no more beds available at the hospital because of staffing, you just have to wait in the ambulance until a bed opens up. It's called wall time, and it can take hours.
That wait can be extraordinary. Sometimes we're waiting 1, 2, 3, 4, upwards of 6 hours. And that's an ambulance that's tied up that can't respond to someone else's emergency.
So what's causing the shortage for our emergency medical responders? EMS crews tell us it's not just one thing. Some left because they didn't want the potentially high exposure to COVID. Some retired early when the pandemic hit. Others left for other medical fields with higher pay. And some left the industry altogether after getting burnt out from covering the extra shifts.
They've been working under conditions they never imagined they'd work in.
And DeLorbe says not only are people leaving the industry, but they aren't getting the typical influx of new EMTs.
Schools themselves have been shut down or delayed, so their programs have been delayed.
And what you get paid in the industry, that doesn't help. We looked at the average salaries for EMTs starting out in the Bay Area. They range from the highest with Highlands County at about $44,000 a year to Hardy County at about $26,000 a year.
We need funding. We need assistance. Most of how we get reimbursed is through Medicare or Medicaid. Those are on fixed fee schedules. We now have a minimum wage mandate that was voted in a few years ago. So now we're looking at moving this workforce to a minimum wage of $15 an hour. We don't have a means to secure more funding to do so.
In October, leaders from national groups representing these emergency workers wrote a letter to Congress asking for help combating the shortage and the problems that came with it. The letter said overall turnover among paramedics and EMTs ranges from 20 to 30% annually, going on to say staffing shortages compromise our ability to respond to healthcare emergencies, especially in rural and underserved parts of the country.
And there's only so much overtime you can do before you're just going to be physically and mentally exhausted.
Bruce Evans, the president of the National Association of Emergency Medical Technicians, says they need Congress to step in and help with funding and benefits to help bring in more workers.
Something very similar to the GI Bill. So we would be proposing that potentially somebody that works on an ambulance in any fashion, and they're there for 3 or 4 years, much like military service, that the Department of Labor would fund your paramedic training in its entirety.
But even with the threat of COVID exposure, the days spent working overtime, the pay, and the stress,
But you still love what you do.
Every day, each and every day, this is what we wake up to do. This is probably the most rewarding career you can ever have. It's a starting point into healthcare. It's a starting point into making a difference in patients' lives each and every day.
And now these crews are asking for people to get in contact with state lawmakers and representatives from their area to help push for more state and federal assistance before things get even worse.